My name is Phyllis and I live in Waterbury, Connecticut.
My name is Maria Lagasse, and I live in Middlebury, Connecticut.
I'm Dr. Zhang. I work in Waterbury Hospital. My specialty is colorectal surgery.
Phyllis and I worked together. As soon as we met, we became very good friends. She is my best friend. I consider her like a big sister to me. She's the most wonderful person I ever met, genuine, and she'll do anything for anybody.
I'm just more low-key than Maria. I'm a little more laid back in some things. You know, Maria takes everything to heart, so we're a little different in that way. I noticed when I went to the bathroom there was blood in the toilet bowl. Not little spots, just complete blood.
It was extremely devastating for me. She had told me about her symptoms and I begged her to go to the doctor, and she waited a while. She didn't tell me the full truth about her symptoms, but every once in a while she'd let something out and I would say, please, you need to go to a doctor. And then finally one day she said to me, Mare, I can't live like this anymore. I need to go to the doctor.
And I called my regular doctor. I got set up for a colonoscopy with Dr. Zhang. And that's how it all started. It's pretty devastating. You know, I came out of the colonoscopy and I knew something was wrong.
I was at work, and after the colonoscopy, she called me, and I just remember letting out a scream at work. I was devastated. It was very scary. I didn't know what to expect. It was very hard, but she was calm. She was calming me down. Dr.
Zhang told me, you know, we're pretty sure you have cancer. So I took pills, chemo pills, and I had radiation for, I think it was roughly 5 weeks at the Lever Center. And then after healing from the radiation, my surgery was scheduled with Dr. Zhang at Waterbury Hospital. And then probably a month or so after my successful surgery, I started intravenous chemotherapy.
Philip came to us. We did local staging and systemic staging. Her rectal cancer was stage 3. So we treat her with we call it neoadjuvant chemoradiation, which is you treat patient with chemoradiation before the surgery and try to shrink the tumor down, and then followed by the surgery. The surgery we did on Phyllis is a robotic surgery. Everything come out with one piece.
That's very interesting because it was probably about a year later, I noticed that I had very different symptoms. I thought that I saw blood in my stool. I did go to my doctor, and when he found out that my best friend had rectal cancer, he thought that maybe I was just getting nervous. Not that I was imagining things, but maybe it was food that I was seeing. So I made a call. They scheduled an appointment with Dr. Zhang, and then we went from there.
2 years later, and Maria came to my office and I had the same symptom like Philip. That was a surprise. I feel like it's maybe not real. We know that rectal bleeding, the most common is hemorrhoid or something else, benign disease. So subsequently we did a colonoscopy. We found rectal cancer and confirmed by the biopsy.
I had a colonoscopy 2 days before my official diagnosis. I also knew that when I came out of the anesthesia that there was something wrong, because they said the doctor wanted to talk to me. So Dr. Zhang said that he found a tumor small, about the size of a strawberry.
So that was a surprise. Maria treatment similar. The staging is T3, stage 3. Even though the tumor is smaller, but some lymph node involved by ultrasound and MRI. So we did similar treatment. The only thing is the after neoadjuvant chemoradiation, Maria, responded very well. The tumor almost disappeared.
It was very scary for me. And I thought I was going to die. just, my whole life flashed before me. When they removed the tumor and the pathology came back, there was no cancer. So they considered that I was, that I had responded very well to the radiation. The chemotherapy had killed the tumor.
The ultimate goal is improve the outcome, better patient care, better survival with this team approach.
I can't say enough wonderful things about Waterbury Hospital, from the staff in the OR, of course, Dr. Zhang and his staff, and then the nurses. I know it sounds so strange, but for such a horrible situation, I had such a wonderful experience. So much empathy from the moment I woke up until I left to go home. I just felt very special. I would never go anywhere else, and that's how I truly feel.
I would never go to any other doctor for that kind of surgery other than Dr. Zhang. He told me when I was first diagnosed that he was going to fix me, take care of me, and I would be fine. Great surgeon, puts you at ease, gives you confidence that you're going to get through this, and he did. I feel that he definitely saved my life.